Good afternoon. My name is Sherry Bailey. I'm going to be doing my video presentation today on service learning. For the assignment, we were told to explore Sentinel City and Sentinel Town and kind of see what things the nurse could do to help improve the community in terms of education and service learning. That's what they called it. While exploring Sentinel City and Town, I did notice one of the things that stuck out to me was the percentage of citizens with STDs. The Better Health Clinic had those percentages showed like on a chart, and it did have a bunch of different STDs and percentages of 15 to 24-year-olds and then 25 plus year olds. And the numbers were, or the percentages, I should say, were pretty high. So I do think that that would be something that you could definitely educate the community on. The ICN position statement that I believe that's relevant to Sentinel City, there's a couple different ones, but the one I'm referring to is regarding patient safety. According to the ICN, a lack of accurate and current health information is a serious threat to patient safety and quality of care. I think one thing that is needed in Sentinel City would be education regarding those STDs and prevention. One way that I would do this if I were the one going about providing this community education or this service learning would be to hold some type of health class or seminar. I think probably a classroom setting might be better. And then there's a few different places you could do it. I think the Better Health Clinic, the community center, or possibly even the public health department. Or even in all three places, because that would give citizens that are in different areas that might have issues with transportation, that would give them the opportunity to attend. You know, it's kind of one on the right side of the city, the middle, the left side of the city, you know. So that would provide easier access. I also noticed that in the school systems, sexual education was noted on one of the special programs for the middle school students, but not for the high school students, which I think is pretty important. I think that that should be included in the high school student curriculum. But the college age had special prevention programs, but those prevention programs only covered HPV and HIV, and that actually wasn't even, those were high percentages in that age, but that wasn't even the highest. So I think that covering just STDs in general would better benefit those college age students. Not only the college age students though, even because it says the ages are higher with the 25 plus year olds. There are a couple of STDs that were higher with the 15 to 24 year olds, but the majority of them were definitely had higher percentages in the 25 plus age range. So I think that those college age students and even older than that aren't in college would definitely benefit a lot from that information. So I think that's a good target that you could get by doing these health classes or seminars that would definitely benefit them. According to Darrow, health education refers to the process of providing accurate information about the course of biomedical conditions, risk factors, people at increased risk, prudent prevention actions, available services and therapies, and possible outcomes of untreated conditions. Health promotion refers to changing behaviors that are associated with disease transmission. So according to both of those definitions, I think those specific things are what you should focus on. I think they should all be kind of brushed up on, you know, people at increased risk, the condition, the risk factors, things to change the behavior, possible outcomes of untreated conditions, all of those things. But I do think in the community education, you should primarily focus on, because these are regular people, not nurses, primarily focus on key prevention methods, health screenings, and also the people that are at highest risk. So you definitely need to, you know, really drill in those things, but you should also talk about everything else too. According to the ICN position statement, One way that the nurse can address patient safety is by informing patients and others about risks and risk reduction. So that's exactly what you would be doing in this community-wide education. You're talking about how to reduce their risks of getting these specific STDs, how to prevent them in the future. By providing this community with that education, that really allows people, community members, citizens to take control of their health and their personal outcomes. I don't believe, though, that this education should be like a one-time thing. I think depending on, obviously what you can do, I would try to make it more of like an annually, annually you go to all 3 locations. That way citizens can come more than just once. And that way you're constantly, giving out this information. That way at least they can say, oh, we got that information, they learned something. And then you never know, you could help to improve that percentage of the people that are affected by STDs. And by doing that, you improve the overall health of the community. One example of service learning in my professional practice would be whenever I worked in the med-surg unit. One thing that we do for every admission that comes through the door, we teach them about stroke signs and symptoms, and signs and symptoms of blood clots as well. So that's the 2 topics that we really drill into people every time they come through the door. So even if they're there for asthma, we still go over that education. That way, maybe whenever they go out to the community and say they're at their grandma's house or their mom's house or wherever they are, if they see someone that starts showing these signs and symptoms of a stroke, they might remember, like, oh yes, I learned about that in the hospital, and that can help them act more quickly and therefore improve patient outcomes and possibly the health of the community. So I do think, because of all these things I listed above that I talked about, service learning is very important. We do it in our daily lives, but just in general, as a nurse, if you can, do other things, extra things to volunteer, to educate people, it's very important. It helps better the health of the community and the citizens and where you live. So it's crucial to nursing.